Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about the news and trends that are impacting our industry today. Joining me is Ernie Shopes, president of our pharmacy business unit, and this episode is part of our mini-series where we look specifically at 2026 and what our internal thought leaders predict will be top of mind in the healthcare space. Thanks for being here today, Ernie.
Thanks, Justine.
Tell me, what are some of the top challenges pharmacies are facing as we're heading into 2026?
Yeah, I think there will be a lot of carryover from 2025. We know there continues to be the resource shortage, pharmacists, technicians, and general healthcare workers. Still a shortage. So we're dealing with that. We have a regulatory landscape that is changing. We have the big, beautiful bill that's impacting stakeholders throughout healthcare, Inflation Reduction Act that's impacting pharmacies. Difficult to navigate and figure that out. We have technology changes, AI. It's everywhere. We can't get away from it. People trying to figure out what it means, how to use it, how not to use it, how to protect things. And we have a drug pipeline that is ever increasing in terms of complexity. The therapies are complex. Intriguing, for me, is the gene and cell therapy that will put a strain on the industry. Maybe not so much in 26, but it'll likely show in 26 and go into 27. But that's going to be a real strain on how do we pay for these very, very expensive multi-million-dollar, medications.
How can data, technology, and like you said, AI, it's everywhere. How can these help pharmacies navigate a lot of these challenges?
Yeah, I think we're at the convergence where, with a shortage, with a complexity, with a number of rules that need to be followed, there's no other option other than automation, right? We need automation, whether that's old school automation, AI, or other. We have to automate the mundane and repeatable tasks. And optimize workflow, optimize efficiencies. We can't rely on manual tasks for an already strained workforce. It's just too risky. And data has always been in the discussion, right? It's been available, it's been accessible, but I think the leaps in technology that are occurring today will improve interoperability and that access. Large organizations are finding ways to share the data, use it in conjunction with the technology for rapid decision making. That it has to come into play. It just has to.
And what is this ultimately going to mean for patient care? What's the ripple effect here? Yeah,
patients obviously are the most important stakeholder in this whole ecosystem, but sometimes it doesn't seem that way. And I think initially it will be a little chaotic with these disruptive changes like AI, technology in general, and the regulatory landscape. There's a lot of confusion. People trying to figure out where to go next, how to deploy these certain things and take the benefits of them. So I think it will be a little chaotic. I do think it will ultimately lead to, better outcomes for the patients. We will have patients that are getting more attention, those that need it. There are patients that, with their conditions, they are very comfortable. They understand their condition. They understand their treatment. They don't need a lot of assistance from the pharmacy or from the healthcare workers. There are others that struggle, maybe newly diagnosed, side effects that are presenting. They need more attention. The automation will make it easier to identify those patients that need more attention and get it, right? So the net effect will be an overall improvement in outcomes and allowing the pharmacies to focus on the patients that need that care. I think it will ultimately lead additionally to improved care plans and leading into personalized medicine with AI and these the use of data in a much, much bigger way. We'll get into these individual treatment plans that are more personalized than they are today.
And what is your number one piece of advice for pharmacy leaders if they're really looking to succeed in 2026?
Yeah, it's interesting. I think my advice would be to try to keep up, pay attention to the technology changes. Don't be afraid of it. Embrace technology. Don't worry about perfection. There isn't a thing. And even if it is perfect, it will only be the perfect for a moment. We see the AI world is changing. If you look at what was available 6 months ago, it's vastly different today than it was even then. So adopt and adapt. Take it, change, find a partner that can grow with you, but don't wait for perfection. Don't be left behind.
Adopt and adapt. I love that.
Yeah.
Certainly very exciting stuff here, Ernie, and it'll be interesting to see what is to come in 2026. But
sure.
I appreciate you taking the time to share some of these thoughts with us today.
Thanks. Glad to be here.
And thank you, of course, to our audience for tuning in. Be sure to check out our other episodes of our Trends and Predictions mini-series.